I know your biggest fear is sagging again, right after a facelift. Unlike temporary threads, this system locks the tissue to the bone. This is a permanent victory against gravity.
Today I'm going to talk about the new technology, the Endochor, the future of the face. In my previous videos, we talked about the ribbon, the mid-face template, and now today we're going to talk about the forehead template and the transplant template. So these are two very innovative pieces that I want to talk about, and I actually frequently use them in rejuvenation procedures. So first I'll talk about the forehead. Normally this template is used for forehead lifting, but I've modified it for other procedures like cat eyes procedure, lateral broth, or temporal lift. So I easily use it in those procedures as well. So imagine that we have our forehead here. It's the same thing as the salmon fish phenomena. It's just quite similar. This mass is quite similar. The muscle layers are quite similar. We'll just try to simulate something like that. So normally when we go for the hair-bearing skin, we dissect the area with the endoscope, and then we elevate this mass layer in the skin over the bone, and then we pull the structures. Normally in the skull area, not here, but a little bit back, we drill a hole with a specific device that is highly secure. Don't be afraid about this. And then we lock this. You see there's a lock here. And then we just embed it. And then the implant seems to be in this direction. Of course, you can customize it according to your needs, according to the surgeon. And then when you pull the structure ahead, like if you want to do a lateral, you pull it lateral. If you want to do it vertical, you pull it vertical to do the forehead lift. And you can see the monoblock fixation that it creates eventually. And then you can add sutures to this to add extra security. And I've mentioned in my previous videos that doing both actually creates an interlocking secure system that prevents any tear or shear that can happen afterwards. Now about the transplant is also a method for the brow lift procedure that you can do through a blepharoplasty surgery. And this enables us to make a brow lift simultaneously with an upper eyelid surgery, and it could be done under local anesthesia. If we decide that the patient needs both together, so we do an incision in the same upper eyelid as we do it for the blepharoplasty, and then we access this area here, this ridge here, as you can see. And so we go below it over the bone, and then we create a space here, and then we drill it with a special drill. We introduce this implant with this applicator here. We just push it with this pen here, with this direction. You see the spikes are facing me rather than you. And so that's going to create the interlocking mechanism. And then we're going to fix the bra over the implant once we release it. And then you'll have a fixed bra in its position that we want to have. And afterwards, we manage the excessive amount of skin in the upper eyelid, and then we end up with the blepharoplasty. So it's all in one procedure. And in good candidates or appropriate candidates, I believe that this method is very innovative and mandatory. If you have any questions regarding this procedure, well experienced, we have a lot of patients in pre-ops. You can look at it from our Instagram, visit our page, and if you're asking anything, we're more than welcome to answer. Welcome to the future of face. Thank you very much.